our residents so that we can be here to provide support and care, and most importantly, information. Today we're providing an update on kind of what's been happening today. We will be providing updates on a daily basis so that we can be as transparent as possible and keep you up to date on all the happenings related to the COVID outbreak in Ottawa County. Also keep in mind that the information is coming in constantly. We are in meetings all day with the state, with the federal CDC partners, and what I tell you today may change very rapidly and be different tomorrow, and that's why we're doing these daily news releases to keep you informed. I want to briefly speak on the current known laboratory confirmed case, what specific health investigation kind of looks like and involves so that you have a better understanding of that, and then a basic process and terms around testing for COVID-19. At this time, we have one case in a middle-aged adult female that we were notified about late Sunday evening. The case did not have a history of travel, and this is important because it indicates a possible exposure from an undiagnosed person within the community. It's important to point out that we believe there is virus in the community, and an unknown number of people may be infected with or without symptoms and not diagnosed by a healthcare provider. This is very important because we want to encourage everybody to follow the governor's directives by staying at least 6 feet away from other people, not doing congregate settings, and following all of the prevention efforts like washing your hands and covering your mouth. And if you're sick, please, please, please stay home and out of the public. Again, keep in mind most individuals are low risk. It's the people that have chronic conditions, those with suppressed immune system, and older adults that are in the highest risk category. For the rest of the population, we're the ones that can transmit it, so we have to watch out for those most at-risk people by following directives. To give everybody a better idea of how we run an investigation, I kind of want to run you through a few steps. We've had a lot of questions about this, and I think this will help clarify things. As soon as the Ottawa County Department of Public Health is notified by the state lab, we contact the person's healthcare provider. This is important because we can get a lot of information from the healthcare provider, and it speeds up our investigative process. We then contact the sick person. We interview that person and we ask them all kinds of questions about when their symptoms started, when they sought health care, where they were just before they started feeling sick, the names of the people that, the names of the people that they may have come in contact with during that time. Then we provide a lot of education. Again, this is a preventative measure. We are educating the case on how to prevent the spread to others, and we inform them that they must stay in isolation until their symptoms are gone and that they have a release from their healthcare provider that says they are now free to go out in public where they won't be contagious anymore. We ask a lot of questions about close contacts. This is sometimes difficult. People don't remember always where they were or who they were in contact. But when we compile that list, we do follow up on every close contact. A close contact is considered somebody who the sick person has come within 6 feet of. So those are who we consider close contacts. Those are who we now jump into this contact investigation process. We contact every single one of those people. We notify them that they may have been exposed. We provide education and information, and we give instructions that they should stay at home and monitor for symptoms. Again, this is a preventative measure. In case they become symptomatic, we don't want them out in the public spreading the disease. For some close contacts, we make daily contacts with them. These are the ones that we know have had a load, we call it a viral load perhaps, and they would be close contacts like people that live in their household where they're interacting with them on a daily basis and exposed to the virus over and over again. We want to monitor those people very closely. The current case that we have, the one case, for that person, we have about 50 close contacts that we have already followed up on. And we have provided all the steps that I just went through, the education. We've informed them about isolating themselves and most importantly, notifying their healthcare provider if they become symptomatic. Also, there have been a lot of terms being flown around since the outbreak started. And I want to just provide a little clarification on those terms because I think they're becoming synonymous with one another in the general population. Screening is the first word that I want to just define. Screening basically includes questions that are being asked to determine if the person may have symptoms of COVID-19. Sample collection is when you meet the eligibility after you go through the screening process. We take a sample and we collect the specimen and we send it into the state lab. The lab testing is once the collected sample, it has been collected, it's sent to the laboratory for testing, and then within 4 days, we receive a result back to us, whether it's negative or positive. We're hearing in the community that because we've had a slight shortage of test kits, that if a person presents at their doctor's office, the doctor may say, you don't meet the exact criteria, but you do have some symptoms that could be related to COVID. So just treat yourself as if you may have COVID. And this is an absolute precautionary measure just in case they have it. It doesn't mean they do, but we want people to make sure that if they have any symptoms consistent with it, that they're not wandering around in the public and potentially spreading the virus. So it's common with influenza, norovirus, other communicable diseases that we've worked with. If you have symptoms, please remain isolated until your symptoms are over, until you're healthy, until your doctor tells you that you may interact with others at that time. One more thing I want to just mention before I wrap it up is on yesterday, the executive order by the governor went into effect at 3 p.m. that closed many types of facilities. These were restaurants and bars and other places of gathering within the community. As you know, the Ottawa County Department of Public Health regulates all food establishments in Ottawa County, and so we have been working very closely with those food establishments since that closure. Everybody has been wonderful in compliance with these orders. This is a hardship. I'll just encourage people to maybe go through the drive-through. It will keep people employed, and I know a lot of people rely on restaurants for food, and so it's important that we are working with them to make sure that they're following safety standards, and I can tell you that they are. They're doing a great job. I also want you to know that all 3 of our hospitals have been working hard to ensure that there are testing sites and that they can get into their healthcare provider if they have symptoms, and they have been wonderful partners, and we couldn't do this without them. On that note, I would like to wrap it up and invite Nick Bonstel, our emergency manager, to the podium. Thank you, Nick.
Good afternoon. I'd just like to give a brief update on basically what we're doing within the Ottawa County Emergency Operations Center in response to COVID-19 and in support of Ottawa County Department of Public Health. As everyone knows, obviously we're under a state of emergency both at a state level and at a federal level, and on March 11th we activated the Emergency Operations Center. Our objectives slightly change, obviously, throughout courses of response, and that's what we're really doing right now is identifying those top priorities and trying to accomplish those tasks. So right now our number one priority here within Ottawa County is coordinating personal protective equipment for the emergency responders within the county. These are the folks who are out there on the front lines every day, and we need to ensure that they're protected and that we can keep that service out there in the community going 24/7. So we're working with several different avenues to try to acquire the PPE to protect our first responders. PPE is personal protective equipment, things like N95 masks, gloves, gowns, hand sanitizer, the equipment that we need them to basically perform safely while they're out there in the field. We're working with our Region 6 Healthcare Coalition partners, Ottawa County Department of Public Health, and our State Emergency Operations Center, and trying to order, acquire, and coordinate these supplies to the agencies who we have on the front lines. We are working with our area fire departments to limit walk-in access, and we're trying to really, like I said, keep that service going and keep those first responders healthy. So what you'll see is probably some access limits to area fire stations, and in the future those will probably be a little bit more broad. And what we're trying to do is, if you have any walk-in type business that you would be doing with any of our area fire departments, try to use, obviously, their non-emergency numbers. Call that administration line and see if you can set up an appointment for someone to meet you. We're really trying to limit the access to those first responders and keep them healthy, obviously, so they can continue working. We're working with our Medical Control Authority to update EMS protocols. As you know, this is a evolving situation. We need to keep up with the protocols. And the schools here within Ottawa County have been unbelievable. The quick coordination and effort that they've had for food distribution to children outside of school hours is incredible. And it's really a solid and strong, very coordinated approach. And really all we're doing is monitoring at this time. There's really no needs other than what they have ongoing. They're doing a great job. Like Lisa said, our area hospitals are key critical infrastructure here within the county. And one good thing that I can definitely pass along is that the capacity currently within our EMS system with the hospitals is manageable. None of our area hospitals are overtaxed or overburdened. Everyone's keeping up and managing the flow of patients. They are still obviously strongly recommending that if you don't have a life-threatening emergency, use some of those telemedicine techniques and contact your physician. Human services these efforts are underway. We're currently vetting community volunteers, background checking them and making sure that they can be out in the community and that they're safe for our community support. We have over 200 currently in the system that are being vetted. And Community Spoke and United Way have joined they've created this unbelievable effort here within the county. And the website that I really want to pass along for everyone to go to is careottawacounty.com. And on that website, you can either volunteer your time, you can donate finances or goods to that website, or you can request services or assistance through that site. On top of that website, we are definitely encouraging any community member who has any community needs to contact 211. And that United Way call center will definitely help to coordinate those resources further here within the county. So on top of that, I said it yesterday, I'm going to say it every day that I'm up here, is we really encourage citizens to think about both the physical but the mental aspect of COVID-19 response here in Ottawa County. So getting your appropriate amount of sleep, managing stress, staying healthy, even utilizing our wonderful parks here within the county, getting out, taking a hike, getting some fresh air. Those are all things that we are lucky enough to have here in Ottawa County. We encourage you to use those. Overall, we continue to have a strong, coordinated, and community-based approach to our response, and we will continue to keep everyone updated every day that we're in operation. So with that, I'll turn it over to Captain Mark Bennett from the Ottawa County Sheriff's Office.
Thank you, Director. Excuse me. Good afternoon. I'd just like to give you a brief update, and I'm pleased to announce that the Sheriff's Office is operating at full capacity at this point, both in the law enforcement side of the house and the corrections side of the house. And the Sheriff yesterday announced some slight amendments to our general business practices. For instance, a series of questions asked by Central Dispatch, and I'll have Director McWaters get into that a little bit in brief later. But so that we can meet complainants outside of a residence to take non-priority emergency information. That seems to be going well. And then preferably, if at all doable, we would like to talk to folks on the phone so that we wouldn't even have to engage them on something that they wish to or just give us information on over the phone. So those slight amendments seem to be going very well. But as always, if we're needed for a response, and contact at a residence or a business will certainly do so. And then limiting contact with our jail population from the outside seems to be going well. Our calls for service yesterday in the last 24-hour period were about average, maybe even a little bit down, which is not so remarkable given the fact that a lot of the business community is now shut down, schools are shut down. So, and again, that all seems to be going very well. So that's really all I have from a law enforcement update at this point. I'd like to bring up Executive Director of Ottawa County Central Dispatch, Pete McWaters.
Good afternoon, everybody. Again, my name is Pete McWaters. I'm the Executive Director of Ottawa County Central Dispatch. We handle all the 911 calls that come in within Ottawa County, including parts of Holland that actually lie in Allegan County. So we're the ones getting all the phone calls that come into our 911 center. Just like to reiterate, we are operating at full staff, 100%. We have not been impacted at this point in any way. We too have taken steps to try and decrease the likelihood of our employees being infected. We have mandatory hand washing, mandatory disinfecting of the workstations, just practicing good hygiene overall with everything that's been recommended with this crisis. We are limiting visitors and we have canceled numerous meetings. We're really limiting access to our building. At this point, we have not experienced increased call volumes. Like the captain said, if anything, maybe we're a little bit under to average, somewhere in there. Things have been taking place as normal, nothing increased or any significant increase whatsoever. We have seen a slight increase in calls from the public requesting information on COVID-19. I just want to reiterate there's other resources for that other than 911. There is a state hotline, and I'll give you the number here. It is 1-888-535-6136. That can be used for informational purposes with regard to COVID-19. We're trying to keep our 911 lines open for true emergencies, so people seeking information, please use that resource. For medical calls, and when time permits, callers to 911 may be asked additional screening questions for COVID-911. That is to help us communicate to our first responders that they might be going into a situation where someone's infected. As the captain said, for police calls, we may ask you to meet the police officers outside to assist with getting the call taken care of outside versus bringing our first responders into the home where somebody might be infected. And again, this is being done to protect our first responders. I just want to close with thanking the first responders, our 911 dispatchers, medical personnel for being on the front lines of this current crisis, and we thank them for the work they're doing. And I'll turn it back over to Christina. Thank you.
All right, thank you, speakers. Now we'd like to open it up for questions, and if you have one, I will go ahead and repeat it up here so our live audience can also hear it. The question is, are those 50 people direct contacts or possibly indirect contacts?
The 50 contacts are considered close contacts only to the sick or the infected person.
And all 50 of those people have been contacted by the health department at this point?
Yes, they have.
Okay.
Yes.
You interviewed the woman at this point. Have you interviewed the woman at this point? What indication do you have as to where she may have contracted the virus? Do you have an indication?
At this point, we do not. As I mentioned earlier, we do know that she did not have a travel history, and therefore there's a certain amount of assumption here that she got it somewhere in the community. And so, you know, that puts us all on high alert because it tells us that the virus is already in the community and circulating in the population. So again, those prevention measures are very, very important.
And of the 50 people that she came in contact with, how many of those folks have been tested at this point?
I am not,
How,
how many of the 50 people have been tested? I'm afraid I don't have that information at this point.
and what kind of measures are those folks taking, those 50 people?
I believe isolation, I'm going to bring our senior epidemiologist up, Jarrell Glasshauer, who may be a little closer to the case investigation.
Yes, good afternoon, everyone. My name is Gerald Glasshauer. I'm the senior epidemiologist for the Ottawa County Department of Public Health. And I think your question was, what measures are being taken? What public health actions are we recommending for those particular individuals? Of those 50 contacts, we have basically two categories that we follow up on. Like Lisa said, the health officer said, those that are in the household are at highest risk. So when we're talking about COVID-19, there's data that we try to make data-driven decisions. So the things that inform our investigation right now are what's known about COVID-19. And so among households, typically the infection rate is a little bit higher just because they're in close proximity for a much longer period of time. And the data out there indicates anywhere from 10 to 15% of household contacts may become infected. Beyond that, so people that have had close contact, 6 feet or more for a prolonged period of time that are not household contacts, the infection rate that we're seeing is quite a bit lower, probably less than 5% based on the data that we have right now. So when we do a contact investigation, we focus on those household contacts because, like I said, the risk of infection is higher, and we do active monitoring every day, checking in with them to see if they have symptoms so that we can quickly identify that and get them to care as quickly as possible. So we just want to be apprised of the situation and stay on top of it. The other tier of contacts that we have are more of a medium risk, people that have had close contact but are not household members. And those folks we ask to self-quarantine. We provide them with information and education so that they know what to do if they develop symptoms. Some of that is written documentation so they know what to do. And then in addition to that, if they need any help with work, we provide them with some documentation that restricts them from work so that they can provide that to their employer. Now, all of these measures that we're talking about right now are part of core public health practice. Contact tracing is something that we do every day. And I think that probably one of the questions that many of you are going to ask is, what about the places that the case may have been? So why isn't there more information out there? So there are other counties that are putting that information out there, and some of that has to do with being able to catch up with the contacts to the case. So right now, we've followed up with about 50 of those contacts, and we feel that at this point, reaching out to those folks and providing them with information and isolating them from the rest of the community is enough. We are considering other measures, like notifying locations or organized events where a person may have been in the future, if we get additional cases, notifying them so that they can share it with the people or attendees at that event. But right now, as the situation stands, we're not going to be releasing any public locations like grocery stores or parks or that kind of thing. And the reason for that is that COVID-19 is not as infectious as other known agents for which we would routinely publish that information. But like I said, this situation is evolving quickly, so our process may change just based on the number of cases, the number of contacts, and what we learn and know about COVID-19.
So you've asked them to self-quarantine, or that's basically if the people haven't come in contact with this?
Correct. We give them written indication to stay home for a certain period of time.
Okay, thank you.
You bet.
That phone number, keep that phone number and specifically what people can do when they call that number.
Yep. Yep, I'll follow up with resources at the end. Were there any other questions for our panel?
Just what Lisa talked about, and a slight shortage of test kits. I have to confess, I'm a little ignorant of how the testing process plays out. Can you talk about, I guess, what that shortage looks like?
The question is about possible test shortage in the state. Is that correct? Locally and in the state, okay.
Yeah.
John's going to speak to that, too.
All right, Darrell will answer the question about testing.
That's a great question and one that's been on everyone's minds. What I can say is that over the past days, a lot of the testing that's been done in the community, almost all of the testing that's been done in the community, has been funneled through the Bureau of Labs. So it's a government lab that does all of the testing or has done most of the testing right now. And we're in a transition phase where this Bureau of Labs, the state lab, has done all the testing to where commercial labs are coming online to be able to do much of the testing. So as far as a slight shortage goes, that has been the case over the past days. But in the days to come, there'll be more commercial testing available, and everything is in transition right now, so hopefully there'll be much more availability in the days to come. And I can say that locally, our healthcare partners are working tirelessly to make that the case.
Just to flesh that out a bit, how often has it been, or have you heard of people going to their primary care physician or the doctor? Have you heard them going someplace asking for a test, saying that I
We've heard that anecdotally, that is, we don't know that to be true, but judging from the number of questions and some of the comments that we're getting, we're wondering if there has been some misinformation floating around there. I've been asked or told, well, so-and-so said that they have COVID and so on and so forth. They're hearing it from somewhere. We don't have validated data in our system that demonstrates anything other than one positive case. And so it's a curiosity that we're hearing from people that they have been told that they're positive. And so we think that there may be just a misunderstanding of terms, that they may be being told, well, you have some of the symptoms, so it's best for you to isolate. And hopes that we're not spreading flu or COVID-D in the community.
Right, thanks for that. I mean,
Yeah.
but my question was just particular to folks who say that they believe they have the symptoms. I want to be tested to see whether I do have it. I mean, you folks heard of like maybe how many people have went to the hospital and turned away because the test isn't available?
I have not heard a number. We pick up some of that on our social media sites too that we monitor just to ensure that we have our pulse on the community. I don't have a number, however.
Yeah,
Christine,
and
wanna speak to that?
there's been a lot of concern about testing, and keep in mind, while that's very important, we also want to make sure that we first consider screening and those most at risk that need to be tested, while we're trying to allocate, though identifying people who are at greatest risk to get those tests done to confirm where the spread is in the community. So we do want to emphasize that screening is a first important step of this process, and all 3 hospitals in Ottawa County, Holland Hospital, Zealand Spectrum Health Hospital, and North Ottawa Community Health Systems all have screening hotlines that people can call for more information. They'll get an assessment, and then the healthcare provider will determine the next steps as far as additional screening, testing, care, anything that's needed. So if you're ready, I can give you those numbers now or at the end. So the Holland Hospital phone number for screening, if people are concerned, they can call 616-394-2080. Zealand Spectrum Health, 616-391-2380. North Ottawa Community Health System, 616-935-7810. And I do want to stress that if you're not feeling well, please call ahead. We're trying to minimize people just showing up at the emergency department. We understand you're greatly concerned and you want to rush in and get treatment. Of course, for any emergency, that needs to happen. But if you're having symptoms that you think may be flu-related or COVID-19 related, we just ask that you call one of those numbers first, just so the hospital staff can be ready.
And just for Lisa and your colleague, I mean, right now, what's the biggest challenge we're facing here in Ottawa County in terms of trying to minimize the spread?
The question was, what is our biggest challenge we're facing in Ottawa County to minimize the spread? Lisa will address that.
You know, a lot of what we're dealing with right now is very, very challenging. But I think the biggest challenge would be just emphasizing how important it is for people to follow the directives that we've put out there. If we can do that, if we do social distancing and we don't congregate, this is going to flatten that curve. And that's really what we're trying to do here. It's the most important thing that we can get out there, and if people comply with it, I think we'll get through this and be healthy.
It had been mentioned that that possible list of exposure points is not going to be made public. Will those places be notified potentially?
Go ahead.
Yeah, that's a good question. Will the places where exposures may have occurred that aren't totally public locations, would those be made, or would those places or organizations or events or exposure locations be notified? And it is our process right now to, as we identify exposure locations, we're going to be taking them on a case-by-case basis and notifying, let's say it was an event and notifying the organizer of the event to share with attendees. Our goals with contact investigations are to identify just those that need to know. Providing exposure locations beyond that can cause worry, and we want to prevent that kind of thing. So we are working in a position right now that organized events and other situations like places of worship or a workplace may get a notification letter of an exposure.
Without giving specifics, are you able to say whether this individual was at a very large event where a significant number of people?
Yeah, so the question was about has the case here in Ottawa County been to any or around any significant events or exposures? And what I'd say right now is the contact investigation is ongoing. With 50 contacts, as we've mentioned, it can be difficult to catch up with all of those folks and identify all the locations that a person was at. So our goal is to inform those locations or organizations or events on a case-by-case basis, and we want to make sure that we notify them before there's any kind of public release.
Any other questions? All right, wrapping up, let me give some final resources. These daily briefings will be on the Ottawa County Facebook page, so be sure to share them with your friends. And the Michigan Department of Health and Human Services hotline, if anyone has questions about COVID-19, again, that number is 1-888-535-6136. Updated information about Ottawa County's response is at miottawa.org/mihealth. To find community resources, visit careottawacounty.com or call 211. If you're looking for different locations for food distribution in the county, you can visit ottawafood.org. For more information on the state's response is at michigan.gov/coronavirus. So all these phone numbers and resources are on our website. So if you have any other questions, please check that out, or you can send us a call or email. Thank you.